All right, up next, we've got Dr. Heather Baltzer. She is a clinician investigator and a hand and peripheral nerve surgeon at UHN's Schroeder Arthritis Institute. She's also director of the Toronto Western Hand Program. Tonight, she's going to tell us about her research that's focused on developing a sensory prosthetic for partial hand amputees. And here's a fun fact about Dr. Baltzer. She is an avid runner, and she's completed 7 marathons. Run up to the stage, Heather.
Thank you very much for the opportunity to share our work. So I want to start by asking you to look at your hands. Look at what you are doing with your hands, what you're holding in your hands. And now imagine doing that with part of your hand missing, your thumb. It's small, but it's mighty. Your thumb represents 40 to 50% of your hand function. So when you lose your thumb, doing things like buttoning your shirt, holding a cup of coffee, writing your name, all become much more of a challenge, if not impossible. Every year in Canada, about 2,000 people will lose their thumbs. This is usually from a trauma, usually work-related, and less than a third of these people are able to return to their original employment. And the reason isn't because they've just lost a digit. They've lost identity, they've lost independence, they've lost confidence. Your thumb is what lets you grasp the world. It lets you create, it lets you connect. So it's far more than just a physical loss. Surgeons are able to reconstruct a thumb. We do this by taking a toe from your foot and bringing it to your hand. It works really well, but it has a lot of morbidity. And many patients are really not interested in going down that route. They say, there's no way I want to give up a toe to reconstruct a thumb. So we can offer them a prosthetic. A prosthetic can act like a post that they can pinch something with, or it can even move with a fancy myoelectric prosthetic. But the problem is that it doesn't feel like a thumb. It doesn't have that connection to the patient's brain. So they feel like it's external. They can't accept it, and so they abandon it. They'd rather use what's left of their hand. So why is that? Well, the answer is here. This is something called the homunculus. This is a map of the sensory cortex of our brains, the part of our brain that gets all of the feedback from our skin on our body. And what this shows us is the representative amount of feedback that each body part gives. And you can see that the thumb is huge. It's bigger than your entire back. It's bigger than your leg. And that's because the thumb gets that much feedback and gives it to your brain. And when you combine it with your index finger, we call it the eyes of the hand. And the reason for that is that when you pinch something and touch it with your index and your thumb, you don't need to look at what you're touching. Your brain can create an image in your head. And so that's why with a prosthetic that has no sensation, there's that lack of connection. The patient just can't understand how to use it. So that is the gap that we are trying to fill with our research. In collaboration with engineers, the Department of Mechanical Engineering at the University of Toronto, we are working to design a sensate prosthetic thumb. The first thing we did was we asked patients that have lost their thumbs, what is it that you would want to see in a prosthetic? And there was a resounding, unanimous answer. They want sensation. They don't care how it looks, they don't care how it moves, they want to have that sensory feedback. And now we're working with 3 amazing patient partners. They're not just participants, they're co-designers. We work together on every iteration of the prosthesis, and they give us feedback on how it is for them and tell us what we need to change and what we need to make better. So on the right, you're looking at an early prototype. It's a prosthetic with a sensory component in the pad of the thumb, and it feeds back to that box on the wrist. Not overly intuitive, but it's something that when we did validated testing with our patient partners, they did far better in validated tests with sorting blocks based on firmness or drawing pictures than when the sensory component was off. They also gave us the qualitative feedback that they felt like it was part of them. They wanted to take it home. They wanted to practice with it. They wanted to use it to brush their teeth. And so these are the kinds of feedback that help us to move this project along. So where are we now? Well, we want to miniaturize this prosthetic. We want to house everything inside the prosthetic thumb, the sensory component and the feedback component. We're using 3D printing and 3D scanning to customize it for each of our patient partners. And essentially, what we're trying to do is not just rebuild a thumb. What we want to do is to rebuild the connection between the patient, the world, and their brain. And that is the power of a thumb. Thank you very much.
Thanks very much, Heather. Very exciting work. I'm just thinking, even if you were to build the perfect thumb, right, the perfect prosthetic, I'm sure there are other challenges, right? Like, how do you know that a patient is going to use it, even though it's the perfect thumb?
Thanks, Mary. I think it's really important to highlight some potential barriers that we've thought about when we're designing this. When we've looked at population-level data for patients that have lost their thumbs, what it seems that they live in more rural regions of the province and in lower socioeconomic status regions. And so what we worry about is that if we make this thumb, they may not be able to access if it's too complex and if it costs too much money. So we are trying to design something that is very low cost and easy for people to use. They don't have to come back for multiple training sessions, that they can train with it one time and then that's it. So those are the things that we're trying to consider as we develop this.
Great. Thanks so much. Dr. Heather Baltzer.